Hello, everyone. It's my distinct pleasure and honor to introduce a good friend and colleague, Dr. Schenck, who is a senior staff psychiatrist at the Minnesota Regional Sleep Disorder Centers in Minneapolis, Minnesota. He is credited with defining RBD initially in 1986. And we'd like to ask Dr. Schenck to provide a narrative and on how this all came about. So, Dr. Schenck, thank you for joining us, and please go ahead.
It's a pleasure, Alon. Well, I should say that I finished my psychiatry residency at the University of Minnesota in 1980, and then 1 year later, I joined the Department of Neurology Sleep Disorder Center, which was a multidisciplinary sleep center. And as it turns out, my first day of practicing sleep medicine was September 11th, 1982. And the second patient I saw, and the first day I practiced sleep medicine, was a very nice gentleman named Donald Dorff from Golden Valley, Minnesota. And he had never been a sleepwalker during his life, but for several years, he had acted out what he called violent moving nightmares, which I think is a very good description for RBD. What prompted him to come to us was that one night he had a vivid dream that he was a football player carrying the ball through the line of scrimmage, and he got slammed to the ground by an enormous defensive tackle. And then he woke up in his bedroom with a gash on his forehead bleeding. And what surprised him the most was not that he was hurt, but the fact that he was not on the football field, but actually in his own bedroom. So he was deep in his dream, acting it out, and then his dream crashed into reality, which was the dresser across the room from his bed. So he really was severely injured, needed stitches. He went to his doctor, who found no medical basis for this problem. And back then, it was understandable for his doctor to refer him to a psychiatrist to make sure there was no psychological basis for this sleep problem. And the psychiatrist found no problem. And then he was referred to our newly established sleep center. And then I evaluated him, and he was a very pleasant gentleman, but I was puzzled because he had never been a sleepwalker. So this is a new type of sleep behavior disorder. 5 nights later, on September 16th, 1982, he was studied in our sleep lab, and I spent the whole night there very, very curious to see what was going to happen. As it turns out, every REM cycle with the rapid eye movements and the typical electroencephalogram of REM sleep, you can see all the muscle jerks, muscle twitching, arm waving, kicking, really vigorous behaviors. And then the next day, I met with the head of our sleep center, Mark Mahaud, who was a neurologist specializing in the brainwave pattern called EEG. And he and our chief technologist, we all kept looking, and we said, this is during REM sleep. And so we said, this is a new parasomnia involving REM sleep with vigorous behaviors. And Mr. Dorff then underwent very careful neurological evaluation, and he was found to have no problem whatsoever. So we followed him every year with a careful neurological exam. And as it turns out, we identified treatment with clonazepam at bedtime as being very effective. Interestingly, it was effective not just for controlling his abnormal behaviors, but also control the abnormal dreams, because he had complained of very vivid, confrontational, aggressive dreams where he was being attacked. He was never the primary aggressor. So we established of our first patient that this is a REM sleep parasomnia called REM sleep behavior disorder. We named it RBD. And we also established that clonazepam was a highly effective treatment. And then over the next few years, we found 4 other patients. And finally, in 1986, we published our initial series of 5 patients in the journal Sleep. Next year, in the journal the American Medical Association, we published another series of 5 to make it a total of 10. And half of those patients had no neurological problem, half did. And as we kept following along over time, we realized by 1996 that 38% of the patients who had no neurological problem when they were diagnosed with RBD, in fact, developed Parkinson's disease or a related neurological disorder. And then we extended our study to 2013, and 81% had converted to a Parkinsonian disorder. So then we realized that RBD in middle-aged and older men was the first sign of future Parkinson's disease and dementia with Lewy bodies. And that set off really a major international effort. The group in Barcelona also found an 82% conversion rate from idiopathic RBD, meaning RBD without any identified neurological disorder, to finally developing a Parkinsonian disorder, and usually in the order of 10 to 15 years. So basically, my whole career in sleep medicine has been tied up with RBD, and I've been so blessed to be working with really outstanding group of neurologists, sleep scientists, and other members of our field to put our heads together to really find out what we can do to intervene with patients with idiopathic RBD to slow down or halt the progression to Parkinson's disease or dementia with Lewy bodies, which is the whole point of the NAPS and the NAPS2 study. What can we do to help people before they develop this neurological disorder? So I'm very excited to be part of this international research group and also the NAPS2 study group in North America, and really for the benefit of patients.
Thank you very much, Dr. Schenck. I can't tell you how many times I'm seeing patients in clinic just today who are telling us, well, you know, we mentioned that this unusual dreams to our primary physicians, and they told us, well, it's okay to dream that you're a martial art instructor and start hitting your aggressors or your intruders in your dreams, and maybe not pay so much attention to what this all means. But you really help us uncover something that is really the tip of the iceberg on trying to help identify neurodegenerative conditions